Good morning. I'm Councilmember Vincent C. Gray. All right, we'll start on my left and your right. Go ahead.
Okay. Good afternoon, Chairperson Gray and members of the Committee on Health. I'm Mary Ann Parker. I'm the staff attorney for the Office of the DC Long-Term Care Ombudsman. I'm here today on behalf of Mark Miller, the DC Long-Term Care Ombudsman, and he would agree with me, more importantly, I'm here today on approximately 7,000 residents receiving long-term care services and supports in the district, in nursing homes, assisted living residents, community residence facilities, and in their private homes through the elderly and persons with physical disability Medicaid waiver. We have submitted our full testimony, so I will just read the main parts. DC Long-Term Care Ombudsman Program is responsible for protecting the care and right of some of the district's most vulnerable citizens through its federal and local mandates, including accountability as one of DC Offices on Aging Senior Service Network provider. Our charge is to represent vulnerable adults, and in doing so, the Ombudsman Program advocates to promote and ensure the highest quality of life and care for these individuals. In fiscal year 2017, the Ombudsman Program closed 529 complaints, resolving more than 93% of those issues to the satisfaction of the care recipients or the complainants. This resolution rate is well beyond the national average. Issues involve quality of life, quality of care, and residents' rights. And again, we've submitted a lot of information, so I'll just read the highlights. And while the Ombudsman Program is able to successfully resolve many complaints by working directly with the provider, we submit formal complaints to the Department of Health, HRLA, when the matter cannot be resolved and or enforcement is needed. We appreciate the timely review and response to these issues. I want to now focus Mark's testimony today on 3 issues relative to the work of Department of Health. Last year, Mark Miller testified to the need of the district to ensure a robust continuum of quality long-term care and supports for residents to utilize according to their preference and needs. What this means is maintaining an adequate supply of services from home care, community options such as adult day, health care, to a range of facility-based options so that DC residents can stay in the district to find appropriate care and don't have to go to our neighbors in Maryland, Virginia, and even beyond. He requested the committee to examine the sufficiency of the current continuum of LTC system to meet the current and future needs of district. And we all, the Ombudsman Program, applauds the recent introduction of the legislation to conduct such a study. Thank you, Chairman Gray. So they're going to do a study to look at the capacity of the district long-term care system. We realize this type of study may require a multi-agency approach and additional staff not currently available to the Health HRLA. Therefore, we support any additional resources that the Department of Health may need to conduct this comprehensive research, but we do feel it's very, very needed. Second, during the 2017 discharge and eviction issues are our single most important complaint. And that isn't just for our program, that's nationwide. We appreciate the help of Dr. Sharon Lewis and the staff of HRLA with addressing and resolving many of these issues. Just recently, their intervention helped ensure 2 residents of the same nursing home were not unfairly discharged to an unsafe location. In addition, we have begun providing training to nursing homes on appropriate discharge processes and residents' rights in order to address this issue, and we hope to have DOH join us in this effort. Finally, we agree that changes are very, very needed to laws governing our assisted living residents. And while we do understand that a recent bill has been introduced to amend the Assisted Living Regulation Act, and we understand that's one process. We are also very pleased to learn from HRLA that they've begun to work to promulgate regulations for the ALRs. And it has consistently been the position of the office that the ALR Regulation Act should be converted to official regulations and opened up for public comment. This ensures an open and transparent process where consumers, advocates, and providers and other interested parties can contribute their ideas. We request that DOH give this task an immediate and high priority and devote necessary resources so the regulations can be promulgated in a timely manner. And also, we always advocate for continued strong enforcement. Thank you very much.
Thank you very much for your testimony, and it will be included fully in the record for this hearing. You heard the testimony earlier. I think you were here. I guess you've been here pretty much all day.
Yes.
And you heard a testimony that was provided by some earlier folks around the assisted living efforts. The suggestion was made, I think, in fact I know, that perhaps there were more resources that were needed by the long-term care ombudsman's office. I've had conversations in the past at one of these hearings with Mr. Miller, and he wasn't in a position, for whatever reason, he wasn't in a position to acknowledge that he may need more resources. Can you speak to that question? Because there was testimony earlier that suggested that more resources would be needed in order to be able to advocate for so many of our aging folks who are in our assisted living programs.
Yes, I can briefly. I'm probably not to the best of Mark Miller's. Could talk to you further about that at another time. Right now, I think we advocate for folks in assisted living, nursing homes, but also community residence facilities licensed by Department of Health, which I think are maybe one or two, but also Department of Behavior Health. And there are over 110 of those scattered throughout the United States, the District of Columbia. And what Mark has really, what he really wants us to have in every single facility is not just, to be there to be complaint oriented, but to be what he calls a regular presence, so that residents can look at us and trust us, because our job is only for one person and one person only. It's the resident. We really can't be bossed around nor listen to anyone else. So his really role since he's been here is to try to make sure we have a regular presence in every single facility, to the point the residents feel comfortable, can tell us complaints, we can see what's going on. And that's why one of the reasons he was talking about more resources, because not of just the long-term care facilities, but also of these approximately 110 community resident facilities licensed by the Department of Behavior Health. And we also then advocate for folks in their homes on the EPD waiver. So we're kind of all over the city, and we can't just go to one facility and just stay there. We need to go to a lot of small facilities. But Mark doesn't want, I know Mark Miller doesn't want us to just start focusing on the small and ignore the bigger ones. I mean, as you heard today in the testimony, we really need to be everywhere all the time. And that's what we're trying to do.
I'm curious about what your reaction was to the statement that was made by one of the witnesses earlier, that people were being required to be accompanied by the management of the assisted living facility when they talked to residents. That seems intrusive to me, and that's probably the mildest term I can use. What was your reaction to that?
It seemed intrusive to me as well, and I did want to definitely follow. Most likely, we do meet on a regular basis with the Department of Health, and I did say we're going to follow up on that because I had not heard that before. So yes, it was concerning, very concerning. Anytime the residents don't feel comfortable, that's an important concern for us.
I'm not sure how anybody could feel comfortable if the folks who you may have concerns about are looking right down your throat as you speak. That seems inappropriate to me. I can't imagine that anybody would come to any conclusions just based on one set of testimony from one person. But you'll never fully get the information, it seems to me, if the person who is speaking is feeling somewhat intimidated and bullied, for want of a better way of putting it, by those who are standing there who may be affected by those statements being made. And I'm sure any responsible professional is going to investigate, what's being said, not simply accept that at face value.
I know, Your Honor, Your Honor, I go to court a little bit. Sorry, Chair. I know that we also will bring complaints to the surveyors during the period of their survey, so the resident doesn't even have to bring up their complaint. We will be there, one of our ombudsmen, and talk to them, and they're always fine with that. And if we say we're giving the complaint anonymously, we don't really get pressure to tell a name, or the Department of Health has never pressured us to provide more information so we know what's going on. And in fact, many facilities, when we say it's anonymous, and they don't usually pressure us. So I would like to look into that more this, what was testified earlier.
We'd appreciate hearing feedback from Mr. Miller
Yes.
about what his findings are as you all further investigate that
Yes.
situation.